Hello, I'm Dr. Peter Lynn, and I'd like to welcome you to our clinic, and I'm going to give you a little tour in just a minute. And then I'm going to talk to you about some things that we might be able to do to help you get better. First of all, this is the front room. This is the counter where you'll check in at, and we have a little bookshelf here. I'd like to direct your attention to a book that I wrote called Barren Harvest. This is a novel on genetically modified foods, and this topic is so important and many people don't know. The foods that are being genetically modified are most soybeans and most corn, and what happens in these products is the body has never seen them before that have been altered like this. So we get a foreign protein, and so what our bodies do is create antibodies to these foreign proteins. Well, in turn, it creates antibodies to our own system. And so now we have an autoimmune problem caused by foreign proteins in our diet and in our environment, and it's a big problem. So I wrote a book about it because it may be part of your problem in your health condition as well. So that's called Barren Harvest, and you can get it on Amazon. We're going to take a trip now back into the clinic, so hopefully I won't run into anything as we continue. But we'll come back in here, and this clinic is split up into two wings. We've got this side over here, but just to make it a little more brief, we're going to go over this way, and I'll continue back this way, and we're going to come back into this hall here where we have a number of treatment rooms. We've got one small one right here, and then we'll keep coming back, and we've got another one here. So we've got a number of different rooms in this clinic of ours, but we're going to go into this first room here. And this room is a very important room. This is one of the first places we're going to find out if we can accept you into our clinic as a patient, if we can help you. And you'll be filling out two different forms, and one is really important. It's called a metabolic form. And from that form, we're going to be able to determine if we can accept you by the questions that you answer. So it's very important that we do that. Then we'll come into this room where we'll do a number of screening tests. One of the things that we'll be doing is a blood pressure. We'll be taking blood pressure on both sides, which is real important to find out the differences in your system. And then we'll be doing oxygen readings. We'll check your concentration of oxygen, and when I ask people about this, sometimes they get it checked, but what's real important is the tissue perfusion of oxygen. Most people with chronic problems have a very low level of oxygen in their tissues. In other words, their body's starving of oxygen, and that is a real critical factor. So we're going to check that. We run a number of neurological tests that I'll explain in just a minute. We might be doing a computerized scan of your nerves and muscles, but it just depends on your problems and what we'll be able to do to help you. So once we accept you as a patient and we do our examinations, and then we can provide a course of care to see if we can really correct your problems. We're going to go back to one more room here, and this room is real important as far as our treatment goes. So, I want to talk to you specifically about fibromyalgia and chronic fatigue or exhaustion. Most people, it usually begins with a period of stress. Some trauma in their life, some chemical stress, or most commonly some significant emotional experience that they've had. It kicks off a whole myriad of symptoms and problems. And one of them is chronic pain going from different parts of their body. It's fleeting. We call it waxing and waning. It comes and goes, and it never stays in one particular area for too long before it travels to somewhere else. The other part is chronic fatigue or just exhaustion. These people, and you may be one of them, wake up tired. They go through their day tired. They're just exhausted, mentally spent. They just don't have energy, and that's part of the process of chronic fatigue and fibromyalgia. But I want to talk to you about what happens. We've got the brain that sends its impulses down the spinal cord out through the nerves to the different organs. And what we find with chronic fatigue fibromyalgia is that communication is so unbalanced. Parts of the brain fire way more than they're supposed to, and other parts fire far less than they're supposed to. So it creates a huge imbalance in the system, and that is a major problem. So we're going to stop and ask a number of questions, and we're going to perform a number of tests. Remember before I talked about this autoimmune problem? If you have an autoimmune problem, we've got to test that out and find out what you're doing that you don't know about that's creating an ongoing autoimmune response, that your body is attacking itself. It's literally attacking the nerve system, it's attacking organs such as the thyroid gland and other organs. So we've got to, first of all, number one, find out what your autoimmune problems are, and if they're not, then we move on to myriad of tests. We're going to run complete blood panels and test out your biochemistry. We're going to run lipid panels to find out your fatty acid metabolism. We're going to check your blood glucose, see if you've got an insulin problem, pre-diabetes. We're going to check your liver, kidneys. We're going to run a thyroid test. We're going to do an adrenal stress test. We're going to do multiple hormone tests. We have to find out what's going on, and nobody's doing this. Once we have all this information, we can go into one of two ways. The first one, which I just mentioned, is the metabolic, getting the biochemistry under control, getting the organs running more efficiently from the inside out, cleaning up the toxins that you've had over your lifetime that are impeding your flow of nerves and not allowing your body's, your organs to heal. So once we get the metabolic side, then we go into the neurological side, and that's where we might be prescribing concentrated oxygen, or we might be giving you glutathione therapy, which is a powerful antioxidant. One of the huge parts of what we're going to be doing, if you're in the program of care, is using functional neurology, literally reprogramming the brain and nerve system to function better than it's had in a long time. So we put these two parts together, the metabolic, the biochemistry part of it, changing your diet, giving you powerful nutraceuticals to balance your metabolic system, and then we do the neurological side of it, and making your nerve system function normally again. We put those two together, plan a course of care, and allow your body to heal like it hasn't done in years, so you can have you feel better, you have more energy, you're not fatigued or tired, and among other things, your life gets back to normal again. So I hope you gained a lot of information from this brief video, and we look forward to meeting you soon. I'm Dr. Peter Lind.